So our leads for today are Drs. Robyn Tamblyn from the Institute of Health Services and Policy Research, Dr. Nancy Edwards from the Institute of Population and Public Health, and Dr. Yves Joanette. So with that said, thank you again, everyone. Robyn, I'm about to hand you control so that you can begin the slides, and I'll just prompt you to unmute yourself so that, again, you can be heard by everyone. Thank you.
Okay, hello everyone. I'm just wanting to check that I'm unmuted. How am I unmuted?
Yes, you are. You sound great.
Okay, so welcome everyone, and thanks Howard for giving us a sort of 101 on how we actually run the webinar. So this is terrific. So it's a pleasure to be one of the three presenters who will be presenting the SPOR network for primary and integrated healthcare innovations. Myself, along with my colleagues, Yves, Joanette, and Nancy Edwards. So we'll be sort of walking you through essentially the purpose of the network, its scope, and what we're hoping to accomplish with this initial developmental funding opportunity. So just to provide a little bit of context, the strategy for patient-oriented research was really to change the way, it is a strategy to change the way that research engages with both healthcare delivery and with the recipients, both patients and care providers and families, in such a way that actually would change the outcomes for Canadians through this new and novel approach to partnership. Forward, not sure how to do this. So I'm just checking how to advance the slides. There we go. Okay, sorry, there we go. Okay, so it really is to build a different way, a different approach by which research, the healthcare system, clinicians, end users such as patients and families, and policymakers can engage together in a continuously learning healthcare system. This is really based on really ideas that have been put together by many lead thinkers in this area that provide a means by which we change the paradigm by which we actually engage in a collaborative effort together to create a continuously learning healthcare system. And the point of all of this is to say, you know, the game has changed, and it is very difficult in this day and age to actually try to change the way care is delivered. If we do research and come back 3 or 4 years later and say, well, this isn't really working, we should do it differently. So we really need to engage in a whole different strategy. So this is not a research network. It is a network that is comprised of 3 major components. The first major component is that it is comprised of a tripartite leadership, which is, yes, scientific in the classic research network sense, but it is a tripartite leadership with clinical leadership and policy leadership, as well as extensive citizen engagement that basically directs where are the high priority areas that we need to address, what are the things that we need to do, what is the policy framework within which we need to do it, what is the policy impact if what we do is successful, how will we evaluate it, and how will we proceed if it is successful to scale it up. And so in order to do those kind of activities in this kind of a complex healthcare system, we believe that you need this kind of tripartite leadership with citizen engagement. And the second part of this, which is very clear, is that you need very timely, almost real-time information from rich data platforms, which in Canada we have a wonderful asset in that we do have population-based administrative data. And if we begin to couple that with the increasingly available digital data from both patient portals, electronic medical records, electronic health records, and other sources of clinical information and social information, and provide the analytics to go with it, that we will then have the capacity to actually do real-time evaluation and analysis. And this will be a new scientific paradigm that we will be engaging in with partnership with end users and healthcare providers. So the goal of this initiative is to create a network of networks, respecting the fact that each and every province and territory runs its own healthcare system, that they will want to build a learning network within their own environment in order to move forward in a transformative way in the healthcare system. And that the foundation of that network is basically community-based primary healthcare. That's recognized as an important foundation for any system that's trying to transform itself from a very acute care centered model into something that is far more responsive and appropriate for chronic disease management, which is really the burden of healthcare today. And to do that well, it means you need to create the capacity for not just vertical integration between primary care and hospital care, but horizontal integration amongst the various sectors in the community, including home care, long-term care, and the not-for-profit and for-profit sectors in community care, as well as housing and education. So that the scope is big, the deliverables are fabulous, and the paradigm change will be exciting to march towards. So this is what is imagined essentially. CIHR and its partners have already made investments or are making investments in provincial, regional-based support units. And the aim of these support units is to provide the infrastructure support for both data, methodology, and leadership in clinical health services research within each and every province and territory, driven by the requirements, needs, assets, and demands of the particular provinces and territories. So building on top of that, this network will build the primary and integrated healthcare innovation network will build as predominantly a practice-based network on top of effectively the support units that will provide it with the kind of support both in data and capacity to actually meet the demands of essentially what needs to happen in a continuously learning healthcare system. And that the global national network, which is really the SPOR national network in primary and integrated healthcare innovations, will be a network of all of these networks. We imagine that what will be necessary and what is in the plan is to have a network coordinating center who will coordinate the efforts of each and every one of these networks and manage sort of a more global knowledge translation capacity development plan, and that the leadership in each of the provincial territorial networks will form a leadership council which will identify the priorities that will be important for the country to address. And what's important about that is to try to figure out where should we focus in the early days that will provide us with some early returns on the investments. And I think this is what everyone would like to see. What is the lowest hanging fruit and how should we tackle it? And so we've identified as some of the lowest hanging fruit for the provinces and territories is to tackle the problem of individuals with complex needs across the life course that create a considerable demand in terms of healthcare. And so being able to address this particular group across the life course will be important, as well as the second part of this, which I think is very key, is dealing with the multi-sectoral integration of upstream prevention strategies and determinants. And so really to focus in this area will allow us to try to reap the benefits of actually tackling some of this low-hanging fruit and take the opportunity to learn essentially from the national Canadian laboratory, which provides us with the opportunity, because each province and territory runs its own healthcare system, of creating one of the richest laboratories in the world in looking at cross-jurisdictional approaches to a common set of problems that are faced not just by Canada, but by many other Western nations. And so with that, I'd like to actually turn it over to my colleague, Yves, who will provide an outline of the network objectives.
That was great, Robyn. Thank you. Yves, if you're ready to begin, I believe you have the presenter ball.
And I think I'm being heard now.
Excellent.
Okay, thank you. And so thanks, Robyn, for having set the stage. And I'll try to start a little bit by sharing the network objectives that are in line with the philosophy you've been just mentioning. So the first of these objectives is to create cross-jurisdictional opportunities to conduct research on the comparative efficiency, cost-effectiveness, and scalability of innovative and integrated models of care that build on the foundation of community-based primary health care and facilitate transitions into and along the care continuum. And this is, each word here is very important, and this cross-jurisdictional, these cross-jurisdictional opportunities are absolutely true for Canada, where we have more than one jurisdiction, and it creates challenges to some extent, but it creates unique opportunities. It's also to accelerate the timely investigation of new interventions and approaches in primary and integrated care across multiple jurisdictions and sectors. And the primary care is important, but it also has, is in our mind integrated with the care across the whole spectrum and across multiple jurisdictions and sectors. The third is to catalyze research on and scale up of the cost effectiveness and innovative approaches to primary and integrated healthcare delivery. And it's also to support for the capacity building among researchers, clinicians, decision makers, and citizen patient families, those that Robyn mentioned, for timely generation and use of primary and integrated healthcare knowledge. Finally, we think that the objective, the last, is to, and not the least, to foster the exchange of information and evidence on successful and unsuccessful interventions, and this is an area where we have to share our unsuccess as much as our success in order to learn, as well as innovative models of primary and integrated healthcare across jurisdictions. All this, of course, to inform policy development. So the network implementation is by itself a phased approach. We already crossed the phase 1 date in November, where there was the launch of the network development grant competition, and we're working to establish management office. The anticipated phase 2 in winter or fall 2014, where will coincide with the launch of a network coordinating center competition, and will establish funders consortium. It will also be the point in time where we'll host a strengthening workshop for network development fund recipients, who will then apply for the full network membership. And all this in order to have the full deployment at phase 3, anticipated end of 2014 or winter 2015, where Leadership Council and Funders Consortium will identify networks research priorities, and member networks will receive funding for this cross-jurisdictional research. So this is a scale-up and a phased approach, which we think will be helping the deployment and the full deployment along with all the stakeholders and partners. So the phase 1, the funds, the objective is to support the development of formal member networks in provincial, territorial, and federal jurisdictions. The federal jurisdictions are the Aboriginal, the penitentiary, the prison, and also the military jurisdiction, to meet 10 membership requirements and of the SPOR network in primary and integrated healthcare innovations. So funding, CIHR will fund up to 14 member networks, 1 for each province and a territory and a federal jurisdiction. The maximum amount for CIHR is up to $75,000. Applicants must match this on a one-to-one basis with 35% of the partner contribution in cash. And the applicants have to be informed that contributions cannot be funds that have previously been leveraged for other CIHR initiatives. Key dates here, the competition launch mid-November. It's been done. Anticipated application deadline is January 10th, and we should have a start by March 1st. So this is phase 1, and for the other phases, I'll pass the microphone to Nancy Edwards, my colleague Nancy.
Thanks very much, Yves. Hopefully everybody can hear me. And I see we've got some questions coming in, which we'll get to in a few minutes, so that's terrific. How are you going to advance the slides for me, I think?
Absolutely.
Yeah. So this outlines some of the membership requirements. There's some of them on this slide and some on the next. And you'll see that reference has already been made to these in the discussion. And really, we launched the development funds because we felt that people probably needed time and so on to meet all of these membership requirements. So at the stage that you're applying for development funds, you don't have to meet all these membership requirements, but you would be indicating how it is that you plan to work towards meeting them for an application of a network. So the first one, Robyn emphasized strongly, and that's the tripartite leadership of the scientists, policymakers, and clinicians. And that's going to look different in each province, we expect, as is the case for each of these. Each of the jurisdictions that puts in an application is going to sort out how it is that they need to address these to meet the needs of their particular province or territory. The strategic scope, you've already seen that as well. That was outlined in the areas of emphasis that Robyn mentioned. And I think I would just emphasize here that with respect to the first strategic scope around the complex care needs across the life course, that what we're asking the network applicants to demonstrate is capacity to evolve the scope of the network over time, to include the age groups from children to older adults, but anticipating that some might come in with one particular kind of age group perhaps emphasized in early days and moving towards a larger scope over time. But the capacity to evolve to that larger scope will need to be demonstrated. And you'll see in the second one the reference to the multisectoral integration and thinking about the integration as it applies both within the healthcare system but also outside the health sector. The third area is engaging key stakeholders. Obviously, this is a really important aspect of the work if we're going to move towards the transformational objectives of this initiative. The fourth area, I think, is an area where we're going to see some really interesting innovation coming from the applicants, looking at citizen, patient, and family engagement. We have chosen to highlight those three areas because if we're talking about public health, we're thinking about the importance of citizen engagement at people who are not patients, but they are part of the public. And for other areas, we'd be talking about patients, and certainly the family piece is really important as well. The fifth area is around capacity for the rapid monitoring and evaluation and feedback. And this really is where the networks will be talking particularly about how they plan to develop their linkages with relevant support units, either in their jurisdiction or perhaps in some cases that might be cross-jurisdictional. Next slide. The sixth area is looking at how we develop the university partnerships around primary and integrated healthcare research capacity. This is a really important one, and again, it's going to look different across the jurisdictions. But if we're serious about moving towards the transformational longer-term objectives that we have here, then the university partnerships are going to be key, and we've got to look at how the healthcare research capacity in this area is actually being built for the future. The seventh area is looking at the implementation and evaluation of e-health solutions that could improve the cost effectiveness of care delivery, and lots of opportunity here, I think, for innovation again. The eighth area concerns geographic scope, so looking at what kind of coverage of practices in this relevant area are set up at the beginning and what it is that we're trying to move towards over the period of funding of the actual networks. Linkage to the community-based primary healthcare teams that have already been funded is a requirement. The teams are aware of that element, and we will be working with the teams to help to orchestrate some of those connections if that's needed. And the 10th one is a requirement for all of the SPOR networks, and that's for partnership funding, for one-to-one partnership funding for the inputs that we're providing from CIHR. Next. So this next slide, this gives you an example of what the research priority setting might look like. It will involve the Network Funder Consortium and the Network Leadership Council. So just as one example, we might have the identification of the cost effectiveness of different models of care for older adults who have chronic conditions, being something that's identified by a number of provinces, provincial networks, with respect to an area where they need some timely research. And so in this scenario, that's hypothetical, we've just imagined that perhaps a member network from province A, from territory B, and from province C are interested, that they decide they're going to collaborate. They sort out their relative contributions that they would like to make this. They might have related outcomes and slightly different outcomes. They would be interested in a cross-jurisdictional comparison of what's being done in one jurisdiction compared to another. And then that application would come in, be peer-reviewed. There is the one-to-one matching on this that is a requirement, as I mentioned. But even though in this case there are only 3 member networks interested in putting money into this, in fact, the entire network may gain. And I think there'll be some very interesting discussion as we get the Funders Consortium and the Leadership Council set up, looking at which province, which territory is actually best suited for a particular kind of research question, given innovation or work that's going on in that area that they would really like to address. The next slide just gives a few other examples, and I won't go through these in detail, but we can perhaps leave that up for a few minutes for you to see. These are just illustrations of a wide range of different challenges that we're hearing about as we've been working with you and with the provinces and territories in the development plans. And again, highlighting that each of these research questions and priorities would relate to some sort of cross-jurisdictional comparison. And the cross-jurisdictional aspect of work is also embedded into the community-based primary healthcare innovation teams. So we think that the work going on through this network and the work going on through the innovation teams will be highly complementary. The final slide just gives you some contact information, but I think we're ready to move on to the questions. And I see there's a whole pile that have been coming in that I haven't been reading because I've been talking. So we'll start the process of answering those.
All right, that was great. Thank you so much, Robyn, Nancy, and Yves. And thank you, everyone, for your very interesting questions that are coming in through the chat box. So again, those questions are coming in through to the host, myself, and the panelists, and I'm trying to sort of feed them back out so that everyone is able to view the variety of questions that are coming through. So just as we're gearing up for the question and answer period, again, we're happy to answer questions in both French and English. And I just wanted to let everyone know that we do have some of our CIHR program delivery folks on the line right now. So they're listening intently to the conversation and the dialogue that's going on. And we're hoping to develop a FAQ document following this webinar so that we have a very comprehensive response to a lot of the issues that arise following this webinar. And again, if there are any specific questions related to applying for the network development funding, you can see there that we have contact information for Colleen and Olivier, who are running the program delivery side of this webinar. So again, we're about to open up to the question and answer period, and then we will follow that with a short poll. So,
I'm happy to start with a few of these questions, and in some cases we may need a bit of clarification. So I see that David Ma has asked about whether the SPOR is expected to be representative and inclusive of members from various jurisdictions within an entire province. David, we might need some clarification from you on that. I'm wondering if you mean from various sectors in what you're asking. Each province, and provinces can join up. They can join up together to submit a network application, or they can join with a territory to submit a network application, for example. But they are submitting that application from that jurisdiction, or two jurisdictions in the case of two territories, for example, that want to submit an application. With respect to the support units, yes, a number of those support units have now been funded and exist, and others are under development. I need somebody else just to indicate where is the best way for people to get information about that, and that's information that we can post so that everybody has that at their fingertips.
Okay. Okay, so I'll just read out the next question. Have jurisdictional liaison contacts been determined, or how to liaise in one specific jurisdiction with the development of a formal member network? So, folks, we're in the process of doing that. We will be posting contact people after we do consultation with the jurisdictions within the next week on the CIHR website, and we can forward this out to all of the participants for this webinar. So we're just consulting with the ministries and with the NAFRO partners about who would be the designated point person in each jurisdiction that would serve as the kind of rallying point for the planning process. The next question is, how would a collaboration of provinces apply in phase one? So we're imagining that some of the provinces might want to collaborate either with other provinces or with certain territories as a way of actually augmenting in a quick fashion their ability to deal in a much more rich and comprehensive sense with the network membership requirements. And that would be something that maybe there have been discussions about already underway. Because we didn't want to, we wanted to provide all degrees of freedom for people to do what they needed to do here, is there is what we call a funding pool, or a pot of money for each province and territory. And if they want to apply together, is they would take their application, put it together as a single application, but each jurisdiction that was wanting to collaborate would apply for their own pot of money with the exact same application. And it would be helpful, and I think this is outlined in the funding opportunity, if you could indicate sort of what the value add was that was seen, and I think that's useful anyway, and probably will be part of the discussion in forming such a collaboration. Another question is, okay. Do the support units that currently exist, and if so, where can we find the information about them? Each and every province has a person who is either the sort of head of the discussion group or the applicant for the support units. We will also provide that list to each and every one of the webinar attendees, and will be on the CIHR website. So some of them are further along the pathway of development than others, but there is a point person that's been identified for each one in each province. So we will be providing the webinar participants with that information. I'll be putting it on the website. The next question is, what are the sources for the one-to-one? Sorry, Nancy, did you want to interject, or Yves?
I was just going to answer the next question, but you go ahead.
Oh, go ahead, go ahead. Go ahead.
It was just a question by Tyrone, where he's asking about whether or not all of the provinces in a collaboration have to meet the eligibility requirement, or is it collective? That's a good question, and I mean, essentially they have to meet it as a collective, and indeed they might want to be coming together because they don't feel that they can meet it as a single jurisdiction. But on the other hand, it's not like one member of that collective can kind of opt out. You want to be looking at the strategic coverage, the scope of the practices that you're reaching, and it would not be appropriate, as just as one example of a network requirement, for you to be saying, well, we're only going to be concerned about the scope of practice in one of our two jurisdictions and not in the other one. But we understand that some provinces and territories might be coming together because they feel that they need to work together in order to meet the eligibility requirements. There's a question here about why we're imposing the requirements in upstream prevention only. I think that's probably one that's targeted for me. The requirements on upstream prevention are part of the horizontal integration. We're expecting that there's going to be integration happening downstream as well, but we want to make it very clear that there has to be an upstream component to this work. You'll see that we've talked about vertical integration and horizontal integration. So you want to think about the upstream and downstream parts of that integration. I hope that helps. For sure, I'm happy to elaborate on that if I haven't answered your question as intended.
I think there was another question about how to achieve the geographic scope.
Okay.
And the source and matching fund. So maybe I'll take on those two. So in the preparation of this, the preparation of this network, for many of you know that this has been on for a number of years now, and that we've had discussions with the provinces and the territories and the health research funding agencies, and the point piece of people that will be identified will be the people who will be working with the people who are interested in developing this network in each region, and many of them have already set aside the funding needed for this developmental fund, or have ideas of how they're going to find that. So I think that addresses that first question.
Maybe I could just add to that, Robyn. In some cases, there may be other sources of matching funds that people decide they want to bring to their application, and that's acceptable too.
Okay, great. And then the geographic scope question. So this is an interesting one, and it was something of a fair bit of discussion. But the idea here is that we want to organically grow these, I'd say, practice-based networks from probably some few areas, regions, and depending upon how the province wants to set it up, to gradually increase in size in terms of the number of communities and practices engaged and involved. And you'll see that in the funding opportunity, essentially a gradual scaling up of the scope and size of this network, with the idea in mind of achieving enough of a scope to start moving the speedometer on improving outcomes for the population by the extent of the engagement of these learning networks in the provinces and territories. So over a space of 10 years, we imagine it would involve approximately certain percent. Sorry, I can't remember the exact percentage. 25% of the population of the respective province. And this is back to the whole issue as people are engaged in a learning system. So it isn't like a research network in that sense, as you're involved in this learning system, that in fact you're changing here in an iterative way on the ground as you speak, and you're learning from each other. And in order to change outcomes for essentially the population, is that we need to gradually start increasing the scope of that network, but it would not start, of course, as a full-scale provincial network. It would start as some proofs of concept, and then that they would actually have the capacity to gradually grow.
There's several questions that have come in related to the funding mechanism and how that will work, both in phase 1 and phase 3, I think. So the maximum for the phase 1, this development fund application, is $75,000 per province or per territory. But if, as Robyn mentioned, if 2 provinces or territories were to come together, then they could apply for a maximum of $150,000. They have to have that amount in matching funds. With respect to phase 3 then, this is where, again, there's a one-to-one matching arrangement. And in some provinces, for example, we're anticipating that the province itself will be funding the network collaboration within that province and jurisdiction. And the CIHR dollars, along with some provincial dollars, would be going into actually funding the research that's going on. So this is where priorities would be established, arising from the clinicians, the policymakers, and the scientists presenting their priorities through the Leadership Council, where a subset of priorities would be identified. and some of the CIHR funds, we anticipate about 70% of the funds overall would be used then for those research projects.
Thanks, Nancy. I just want to clarify some points that wasn't understood. So the question is, can you please clarify whether the provincial leaders for the provincial networks have already been identified? And so there's two issues here. One is the leaders of the support units. And the point people for the support units have been identified for some time in the provinces. And so those are known, and gradually as they've moved from developing the support unit into the full-scale ramp-up of the support unit, that leadership may change, but those are all identified. When it comes to network, this tripartite leadership, we're leaving it to the community to define who is the science lead, who is the policy lead, and who is the clinical lead, and to identify a mechanism by which that can happen. So we're not presuming that it will be the same in each province and territory, but we're leaving out to the jurisdictions to figure out how they would like to do that. But we do need leadership in each of those three areas. The other question was whether or not we're accepting more than one application from each jurisdiction. We are doing that, but we need to be very clear on the understanding here is that when it comes time for the application for the full network, we will only accept one. So it would seem reasonable to try to use this development opportunity to try to mobilize essentially the key players who need to be there. Should there be multiple competing players, of course, they will have to sort this out when it finally comes to submitting the full network application.
With respect to the deadline, good question. That, unfortunately, is essentially a hard and fast deadline, and the reason is that we have to get the money available for this out in this fiscal year, and if we don't have the applications in by January 10th, it does not give us the time that we need for peer review and for decisions to move the money out in this financial year. We know that that's going to be challenging. We recognize that there are Christmas holidays thrown into the mix, as Sarah has pointed out. But this is an application that involves identifying how you're going to work towards meeting the network requirements. I think maybe then I can talk to the question about how would you address geographic scope in the application. And I think that, for each of the criteria, how each jurisdiction addresses it is going to be different, because in some cases you may be saying, we feel we've already got a lot of work that's happened, and we're almost ready to address that criterion at the moment. In other cases, you're saying, with respect to geographic scope, we actually need to be looking at this within our province. This is how we're going to do it, and that will be part of what we build in. So you want to speak to each of the criteria, but there will only be some that you might feel that you can meet at this time, but you want to convince us that you can meet them, and you're working on methods to meet them by the time of the full network application. Robyn or Yves, you might want to add to that.
No, I think that's great, Nancy. I can take on another couple of questions that have come through. So the next question, is a clinical researcher eligible to be clinical lead? So as I mentioned, in fact, we have identified that there needs to be tripartite leadership, that leadership needs to be identified in each province and territory. The reason we went after tripartite leadership is we realized if you're really going to move the dial, you want to change the way care is being delivered in a positive direction, that you will need clinical leadership in identifying the gaps, the holes, the opportunities, and mobilizing the clinical community and the end users and engaging them, and actually to move forward in a positive way. And the second thing you'll need is you will need policy leadership, and basically that will essentially identify what are the barriers, enablers, and facilitators, and be able to identify what would need to be changed if you want to move from a smaller scale experimental innovation up into a more full-scale regional and then provincial application. Is clearly and often are policy enablers and facilitators and barriers that would need to be addressed. And so the policy lead is critical in figuring out how to make it fit within that context, within that jurisdiction. And then finally, the science lead, in order to take the priorities, the innovations that are coming forward, and wrap around it strong methodology for answering it, not in 5 years, but in much more real time and more rapid ways to inform the innovations and transformations going forward. And so really, I think the answer about can it be a clinical researcher be the lead, in some jurisdictions and for some networks that may make an awful lot of sense. It would really depend upon the players on the ground and the engagement that the person would have in providing, and credibility that person would have in providing that leadership.
There's a couple of questions that have been asked by Chris and Bo. We've partly answered them, but let me just elaborate a little bit. So the intention is to have every province and territory in as a member network. In some cases, that might be collaboratively at the full network stage. And as Robyn said, there would only be one network per province or per territory at that stage. And the other question is around timing. So we anticipate that in the next round, when people are applying to become a network of the network, and when we've got actually a more substantial, longer application that will probably have to be prepared in more details and so on, that there will be a longer time period provided for people to apply. We'll try to avoid Christmas, I think, if at all possible.
That's great, Nancy. I have another question. The question is, I assume that it's possible to have members from other provinces that still have the application represent one province. Is this correct? This is absolutely correct. And I know that individuals in the various provinces and territories, some of them have interjurisdictional across Canada collaborations, and I think that will fuel the opportunities, the accelerator to actually do interjurisdictional work. We see this as a very positive feature. And in fact, the community-based primary healthcare teams that we have made a prerequisite to be integrated in here had as their mandate and requirement that there be interjurisdictional members to their network. And that will, I think, form some foundational basis for actually developing some interjurisdictional methodological work that really will need to be done. In addition, of course, members in a network may also have international collaborators, both at the decision maker level, at the clinical leadership level, and at the research level, and that will simply further enrich these learning networks within each jurisdiction.
The data has asked for a point of clarification on the example I used with the network A, B, and C, and thanks for asking that. I should have been clearer. That example is pertinent only at phase 3. And at phase 3, you see that there's the Leadership Council, and it is through the mechanism of the Leadership Council where all of the jurisdictional members, jurisdictional networks will be represented, that they will be bringing forward what they identify as potential priorities from their member network, and then discussing what it is that they actually want to take on in terms of priorities across jurisdictional elements. So we certainly don't expect that that's something that you can be figuring out at this point. This is, you're in a very early nascent period. This is some time from now once we're into phase 3.
Okay, the next question is from Sabrina Kinsella. The question is it possible to participate at some level in partnership with other jurisdictions without being a separate applicant with matching funds? Could a region, for example, that could offer matching funds be included as a research site if that was of interest to one of the existing networks? And I think this is definitely a possibility. And in fact, we would encourage that to identify other jurisdictions that you may be interested in working with, either because of an alliance of priorities and interest, or of geographic proximity, or whatever the reason, and that to work together to come up with a common application that would include you both with your assets and why that would matter, and whether or not you, and that would solve the issue of maybe lower capacity in some areas to provide that kind of tripartite leadership that you would come in with a combined application because of, I'd say, technical realities at CIHR. is we simply need you to take that collaborative single application and submit it twice, once for each of the jurisdictional specific pots of money, but the understanding this is a collaborative application between 2 or more jurisdictions.
Robyn, maybe we should give Yves a chance here in case there's a couple of questions he'd like to answer.
Sorry, beg your pardon, Nancy?
Yves might have a couple of questions he wants to answer, so I'm just providing some space for him.
No, thank you, Robyn and Nancy, because I think that one thing I saw, because I was looking at all these comments, is that the slides and the webinar will be made available, and that's real important, and all the questions will be inspiring some FAQ that will be disseminated. Now, Fred Birch has posted a couple of times that he would like to have some kind of financial scale for phase 2, and I'd like to be helped here because I don't have the scale in my mind. So, Robyn, it's on the slide that the financial scale is.
I'd be pleased to answer that. So what we've identified is that for each network application is that they would be provided with an estimated budget of $150,000 per year. We are devoting 65%, essentially, roughly speaking, of, it depends, of course, on how many applications come in and so on, but 65% of the overall $25 million budget envelope for this network, which is the minimum investment that from the CIHR perspective that we're making. It could grow over time, but 65% of that to the actual interjurisdictional research program. So the phase 2 network funds are really to provide that network with the infrastructure needed to operate. And then as they choose to participate in the interjurisdictional research program that fit with their own priorities and make sense, is that they would gain additional funding to conduct their part of the research in their jurisdiction.
There's a question that got forwarded about the scientific lead being perceived as the nominated principal investigator. The eligibility to be a nominated principal investigator relates to CIHR rules. So it may very well be, in most cases, that it will be somebody who is a researcher, but it could be a clinician scientist and so on. I'm not sure how it is that might make collaboration difficult, so it would be useful perhaps to understand sort of a little bit more about what's behind that question. I think it's the tripartite leadership here, as Robyn has mentioned, that's really important. And there is a governance structure which is partially represented in the example that I provided for phase 3, that provides a mechanism by which research questions are going to surface within the provinces and territories and then be brought to the Network Council, as we said, for decision making. And then as the research findings are coming in, that information and those findings finding their way back to the provinces as part of the real-time information they have to help with as a consideration with policy decisions. Certainly, I think one of the things that we'll be looking for through the peer review process is, how that scientific lead is connected with other scientists and so on within that province and within that territory. And I'm using the term province and territory to mean jurisdiction. I think we may have covered just about all the questions, unless we've skipped over some here.
Yeah, so I want to say thank you again to everyone for all of their questions. And I think just as we're waiting for the last couple of questions to filter in just before the end of the session, I'm just going to say again a big thank you to everyone for participating. And we'd just like you to take part in our very short poll just to give us a little bit of feedback on how we did on today's session and how we can improve upon future webinars of this nature. So again, just if everyone can take a couple of minutes to just fill in the short poll and keep your questions coming. It's great. Thank you very much.
How is there an opportunity to answer a few more questions?
Oh, absolutely, Robyn, by all means.
Okay, so this is from Jeannie Haggerty, and it basically says, I'm not sure, let me just see now, how the funding for phase 3 would work. Okay, so this is you know, I think this is the plan as outlined. There isn't a separate funding pool for each network from the what you might call the research operating fund part of the 65% that I mentioned already. Is that this is really a function of the priorities that are put forth by the provinces. So if in fact you know, approaches to autonomous aging at home, let's say, is a priority for many provinces. We know that already. And we also know that different provinces are taking different approaches to that. If that sort of sifts up from the, or a grassroots network, up to leaders of council and say, this is really a big priority for us. And we have 3 or 4 provinces that are doing different approaches, and they want to, they see this as a priority to actually compare the effectiveness of different approaches that have maybe multiple facets to them. Those 4 provinces will put together essentially a common protocol for doing that research and the funding that they would believe would be necessary and allocated to that work, and they would proceed to get approved for that work through a peer review process, and onward they would go. So this is left actually very much as an organic grassroots. What are the priorities? Where are the opportunities? Where is the opportunity for great learning from what is local experimentation? And so we are not restricting it to sort of say that each province gets its own share. Some provinces may say, you know, I'm not interested in any of that. I've got a plan, and they're not going to change it, and for all sorts of reasons. And they won't be interested in that, but they're interested in something completely different. And so the size of the funding that will go to each province will be a function of the participation and interest in these common set of priorities, and the engines on the ground that will enable them to do that.
Yes, and just further to that, I mean, some provinces and territories may say, that's a really interesting question. We're not going to participate in the research, but we're really keen to hear what the results are, because, you know, we can see ourselves starting to make some decisions in that direction in the next couple of years, but we have no innovative models in that area that we want to test at the moment.
So when it comes to the matching then about those funds, is if we put 65% of it aside, is that CIHR is coming in saying, oh, we're matching 1-to-1. So if you put together an interjurisdictional program of research with 4 provinces, and they say, look, the budget for this thing is going to be about $500,000 or $250,000, the CIHR will match on that. So the provinces that are not interested in that will not be putting up money, but they will be benefiting, as Nancy points out, from the learnings from that experience. They may want to put their matching funds into something that's different that involves other provinces. So it's kind of a win-win situation, I think, for provinces to participate in a process that allows them to identify and put their money into priorities and get more than they would. They get a 1 + 1 = 3 because they get the benefit of actually almost contemporaneous experiments that are happening in other provinces. It also allows us futuristically to think about actually bringing in other countries and other regions who have already indicated they're interested in being part of the international part of this network, so that we can have even more learning from other countries.
There's a question that's come up about how people can communicate with others who are interested in their province and ways to facilitate a process. So this is where, as Robyn mentioned a few minutes ago, we have asked each of our provincial jurisdictions if there is a point person that they would like to suggest who can help with that connecting. And that information we'll be getting out to you within the next week. We're just getting that information in from the provinces and territories right now. And with respect to announcing the provincial support unit leads, again, we can provide some of that information over the next few days, and then some of it will be later coming in. Not all of the provincial support units are in yet to CIHR. Robyn, you can correct me if I've got that wrong.
No, absolutely not. That's great, Nancy. I just want to find a little point here. All of the questions that were asked in this webinar will be, and answers will be distributed to everyone who's on the webinar and will be on our website. We will be holding future webinars for people who couldn't participate in this one, dates yet to be set, so there will be additional opportunities for learning through that mechanism, but we will also make sure that people have this available to them, the questions and answers from this session. If you have further questions, please, I think we have there we go. Thank you. Here are the contacts for questions from each of the 4 institutes that are involved in this, well, 5, sorry, excuse me, 5 institutes that are involved in this initiative.
Thank you, Robyn. And with that, I would just like to thank everyone for, again, taking the time to participate in this webinar and for providing your feedback and your responses. We look forward to hopefully working with you further in the development of this SPOR network. And again, we hope to provide the PowerPoint presentation, the recording, and the FAQ document as soon and swiftly as possible. I'd like to thank you all again and have a great and wonderful day. Thank you very much.
Yeah,
thanks, everyone.
Thank you.